I grew up in northern Indiana, just outside of South Bend, Indiana. Grew up on a farm out there and went to a little Catholic school growing up, all the way through high school. And then I had a full academic scholarship to Indiana State University, where I studied biology. Got into Pikeville School of Osteopathic Medicine after that in Eastern Kentucky, and I did my medical school there. Graduated and just got done with my residency just outside of Pittsburgh in East Liverpool, Ohio in internal medicine, and through a happy series of events ended up here in Ephraim, McDowell, and been here for a month and a half, and I love it. As a young child, I have a genetic abnormality that makes me different than most people. So from a very young age, I had to know the human anatomy and be able to explain to people how I was different. Growing up, I very much appreciated and loved dealing with people and being able to help people. So the two kind of merged hand in hand from a very young age on, and I basically have wanted to be a doctor ever since I was a little kid. I did a lot of my training inside of a hospital taking care of very sick patients. And I basically learned in a very hands-on environment, and now I've been able to transition that into clinic care. What I like about internal medicine is that I get to deal with a wide variety of cases. I get to see interesting things all over the board, from pulmonology, cardiology, GI. I like to work with my patients and do the best thing that I can to coordinate care very well. I also like to explain the medical conditions very well to my patients, because if they don't understand what's going on, why I'm prescribing a medication, what that medication will do for them, they're less likely to take it or think that it's as important to them as it really is. I deal with patients age 18 years or older, and I basically deal with a wide variety of medical conditions. And being a primary practitioner, I do the best that I can to deal with the issue myself. And if I can't, I'll get you to the appropriate specialist as necessary. It's really great to see my patients come back in and tell me, man, what you did, doc, it worked. It really worked. And at the end of the day, I like to see my patients significantly improve.